you from making all the mistakes when you're trying to differentiate physical anatomy, and also a few tips and tricks that can help you differentiate the different anatomies when you're actually looking at them in the gross anatomy lab. So the first thing we want to go over is the muscle that's at the top, or the most anterior muscle that we're looking at. So that muscle typically that most people start with is your deltoid. It's the muscle that goes over top of your shoulder, or it just lays right over that humerus, just in this area right here. This one is innervated by our axillary nerve. It is the only muscle in this arm area that's innervated by that nerve. All the other muscles in this area are innervated by a nerve called the musculocutaneous nerve. So all the other muscles on the anterior surface of the arm are innervated by the musculocutaneous nerve, and all the muscles on the posterior side of the arm are innervated by our radial nerve. So musculocutaneous on this side, radial nerve on this side, and the deltoid is innervated by our axillary nerve. So there are two major layers of muscles on our anterior side of our arm that we need to be aware of. And the first layer is our biceps brachii. Our biceps brachii makes up the most superficial part of the arm muscles, and it's made up of two heads. Hence the word biceps. Biceps is an indicator of the number 2, and ceps is a suffix for the word head. So 2 heads, biceps. So when we think about a biceps, it's composed of the long head and the short head. So how I remember where the long head is that it starts with an L. So L is an indicator of lateral side. So the long head is on the lateral side of the arm. So it's the muscle that is the lateral head of the biceps when we're looking at it. It's on this side. The other head is the short head, and the short head then is on the medial side. So when we're looking at the biceps, the one you're seeing up here on this side, that is my short head. So short head on this side, long head on this side. Both of these heads attach to the scapula. Another major difference between the short head and the long head of the biceps is that the short head literally is a shorter head of the muscle than your long head. So because that long head is longer, its tendon has to travel along a different pathway than the tendon of the short head. So the short head has one attachment down here at your radius, and then the other place it attaches is up here at the scapula. It attaches straight along, and the muscle head is right here, and it goes right up. But the long head is a little different. The long head travels up the side of the arm, and its tendon actually passes through the groove of the humerus, and that's exactly why it's there. And then it attaches at the scapula. The long head and the short head attach at slightly different locations because of this difference in how they come up along the humerus. So that's the first layer of your anterior muscles of the arm. The second layer, or the deeper layer of the anterior muscles of the arm, is composed of 3 different muscles. So the first of these muscles is that we're going to go over is called the coracoradialis. The coracoradialis is attached at a similar location up here at the scapula as your long head and the short head of your biceps. So it is typically confused with the short head of the biceps. But how you can differentiate the coracoradialis from the short head of your biceps is by their attachments. So like I told you before, the short head of the biceps attaches at the radius and at the scapula. But the coracoradialis, it does attach at the scapula, but its second attachment is one of the tubercles of the humerus. So it's not going to travel all the way down. So when you're looking at gross anatomy, pictures or in a cadaver, look at where those 2 muscles attach. See if you can find a clear path to attachment. And when you're getting tested on practicals, the professors are going to try and show you the 2 places that they're attached. So that's what's going to let you know which muscle is which, so you don't get them confused. Also see if you can tell if a muscle is reflected or not. So if a muscle has been cut and moved out the way, then that lets you know that you're probably looking at the coracoradialis and not the short head of your biceps, because the short head of your biceps is just under the skin. So those are just a few ways that you can differentiate those 2 muscles. Now, when we're looking at the lateral side of the arm, there is one other muscle that is typically confused with the long head of the biceps. And that muscle is what we call our brachialis. So your brachialis can be differentiated similarly to how your coracoradialis can be differentiated from the short head. So when you're looking at your brachioradialis, it's slightly different because the attachments that you're looking at are different. So when we looked at the coracoradialis, we were looking at the more top or superior attachments, but here we're looking at the more distal attachments. So both the long head and the brachioradialis are attached somewhere around on the radius. But the difference is that the brachioradialis only goes about halfway up the humerus, and it attaches at a tubercle. Similarly to how the corticoradialis comes down about halfway down the arm and attaches halfway through the humerus. Same thing happens, but from the opposite end. Here we're going to have the long head of the biceps also coming from the radius and attaching all the way up at your scapula. So again, the attachments matter. So, like I said in the video on my Instagram, and if you're not following me on Instagram, make sure you follow me at SpillingTheBiology, and also on TikTok at SpillingTheBiology. I talked about a video for some tips about how to keep up with anatomy, and this is one of the reasons why they tell you to learn the attachments and insertions. It's not because they want you, or the proximal and distal attachments, it's not because they want you to just memorize pointless things. It's because a lot of times the muscles are in the same area. So by knowing where they're attached, or the general area, or at least the nerve, the bone they're attached to, it allows you to be able to differentiate. So notice I didn't really tell you any specific bone markings or anything like that they were attached to, like the specific attachment or insertion that we were talking about, but I was able to tell you the general area so that I can label it when I'm looking at it in the body. That's why you typically don't see attachment questions on practicals or on exams, because they're not really clinically important. They're just important when it comes to you identifying the muscle and being able to find it in the body. So the last muscle of the arm that we're going to talk about is what we call the brachioradialis. So this muscle is typically confused when you're spelling it or writing out with the brachialis, because they're similar in spelling. And it's also typically confused with some of the forearm muscles because it's in a similar area. So the brachioradialis is kind of like the connection between the forearm and the arm. That's kind of how I like to think of it, because that's literally what it's doing. It's connecting the brachial portion of the arm with the forearm portion of the arm. So brachii is an indication of the top of the arm, because this is what we call the brachial plexus. This is the brachial artery up here. So that's why the prefix is brachii. So brachial lets you know that it's coming from up here. So this is attached at the humerus somewhere. And then it comes down to attach at the radius. Radialis is your indication for that. So brachioradialis is going to be on your lateral side or your thumb side, and the ending, the suffix, lets you know that that's going to be happening, because radialis, thumb side. And it attaches just like this. So when you feel this muscle right here on the outside of your elbow on the lateral side, that's your brachioradialis. And that's why a lot of people confuse it with forearm muscles, because when it's attached, and when you look at it in a cadaver or in pictures, it does kind of blend into those top forearm muscles. But remember that this one's on the lateral side, and all the forearm muscles come from the medial side. So all the forearm muscles push out from the medial side and come out like this. So this lateral muscle lets you know that it's considered an arm muscle and not a forearm muscle. So I hope that helps you when you're looking at your anatomy and looking at cadavers and trying to differentiate the different muscles in the body.